After last week's massive overdose and how that directed more than 24 people, the mayor's office reports that they are aware of at least 8 of that group who sought treatment since the event. But on the ground, clinics say they haven't seen much of an uptick. WMAR 2 News' Blair Sable explains why even after an incident like this, it may not quite be a wake-up call for everyone.
Unfortunately, a majority of the people who use drugs in Baltimore report witnessing overdoses. And so they may not have viewed that as sort of a shocking moment or something where they sort of needed to be scared straight into drug treatment, because it is increasingly common for folks.
On Thursday, a stark reminder the opioid crisis is still ongoing in Baltimore. 27 sickened by an unknown drug believed to have possibly originated from free tester drugs handed out on the street.
I've never seen nothing like this in my 27 years of recovery and doing this business.
On Monday morning, advocates like Bernard Nelson with the Penn North Wellness and Recovery Center were back out on the sidewalk serving their community, a line forming for food and harm reduction products on Pennsylvania Avenue. But the interest in longer-term recovery programs, even after such a shocking event, Nelson says they've only seen maybe 1 or 2.
Some people, they be fighting the process. For one, they being traumatized while they out here on earth. And traumatized, it comes, a lot with a whole lot of people. You never know what they are being traumatized by.
There also may be people thinking, I tried it once and it didn't work for me, so why would I try it again? Or I'm just tired of trying it and it's not working.
Catherine Tomko, an assistant scientist with the Johns Hopkins School of Public Health who studies substance use, mental health, and marginalized populations, says there are several obstacles for those who may be experiencing addiction and seeking treatment. Some clinics in the area were also closed or had limited services over the weekend. She says in addition to the harm reduction strategies, the focus also needs to be on increasing low barrier access to treatment, which is part of the city's overdose strategic plan.
You cannot force someone into treatment when they aren't ready. You have to be there to make sure that they are able to do that. And the first and most important thing that you have to be in order to get treatment is be alive.
Nelson says when someone is ready, they will be too.
We have struggled, but we keep going. We keep going because we Penn North strong.
Baltimore police continue to investigate the culprit behind the mass overdose. In Penn North, Blair Sable, WMAR 2 News.